And with regards to training of young fellows like myself, can you briefly discuss the learning curve from going from a femoral axis primarily to going to radially?
Well, I think that this is really a very important point for the discussion, because radial approach is for sure slightly technically more demanding than femoral approach. That's actually for two major reasons. The radial artery per se is a little bit smaller in terms of caliber, so it's a little bit more difficult to cannulate. But most importantly, sometimes you have to be in the position to try to handle smaller catheters. So the procedure per se is a little bit more challenging, and that's why to become proficient in radial approach, you need to have a lot of expertise in transradial intervention. I did that switching some years ago myself, and I think the switching phase from femoral to radial has to be in a stepwise manner. First, you need to tackle relatively easy cases, I would say even diagnostic cases, without even embarking in complex PCI procedure. Then maybe elective, slightly more complicated PCI procedure, and only then I would say you have to tackle the ACS patient population. The last subset of patients you may want to treat transradially is probably the STEMI patient population, especially those are coming with ongoing chest pain, maybe hemodynamic instability, 4 o'clock over the night where you are completely alone. That patient population is probably the last you have to tackle with the radial approach. I would say that overall the transition from femoral to radial would take 3, 4, 5 years, depending on how many procedures you are doing. So the number of procedures is really very important. And actually in our study, we saw that if at the center level, the number of procedures performed transradially was in excess of 80%. In those centers, there was a clear mortality benefit. But if the number of procedures was not that high, then the mortality benefit was pretty much null. The mortality signal was null between radial and femoral, which really speaks for the fact that you can easily prevent bleeding complication, but to become really good in radial, really to invest in a lot of procedure doing transradially.
Wow. So that's very impressive work.